Welcome back to the Morning Blend. Colon cancer kills more than 50,000 Americans every year. If it's caught early, it's very treatable and beatable. There's a good screening tool to help in that early diagnosis. So here's the question: why don't more people use it?
Dr. Michael Schmalz and Dr. Michael Malloy are gastroenterologists from GI Associates with more. Hi, gentlemen.
Good morning.
Nice
Thanks
to have
for
you.
being here. March is Colon Cancer Awareness Month. Why is it important to have a month dedicated to colon cancer?
Well, colon cancer, as you already said, is a very common cancer. It affects 1 in 16 people, or an incidence of about 6% in this population. So it generally touches the lives of a lot of people or a lot of families. And it's an easily preventable and curable cancer if you catch it early enough. And as you'll hear, colonoscopy is the gold standard right now. It's a simple test that saves lives and prevents the disease.
Generally speaking, it's a fairly slow-growing cancer, right? So I know you recommend tests at 50 and over.
Yeah, the American Cancer Society has realized that age 50 is the time when you should start screening, because that's when the incidence starts to go up. By screening early, we hope to catch cancers early, or more importantly, the precancerous lesions that can lead to cancer, like polyps.
Who's somebody who is at risk for colon cancer? I just had a friend of mine who recently was diagnosed, did have the surgery to remove, and is now considered to be okay. But you know, and I think that's a common story. But is it something that is genetic? Is it a lifestyle risk?
There's many factors. Any human is at risk for colon cancer, and once they're 50, as Mike was saying, the risk starts to go up, skyrockets. It starts to increase a little bit at the age of 40, and in African Americans, it starts to go up at even a little bit of a younger age, 45, according to the American Gastroenterology Association, recommends screening for African Americans at 45. A lot of insurance companies don't always recognize that, but we always figure out a way to get it done.
So you have this screening tool that's very effective, very good at catching things like polyps early, so that you can actually prevent the cancer,
Correct.
not just treat it. It's treatable, it's beatable. Why don't more people get colonoscopies?
I think people are just afraid. It's a scary test. It is invasive, there's no doubt about it, but in the hands of a qualified person to do it, with sedation, and with a little gentle hand-holding, people can get through it just fine.
And it equally affects men and women, or is it a little bit
No, it's pretty
skewed?
It's pretty fair between the two genders, and it affects every human.
What about having the test? I mean, I feel like, you know, since, my parents will say, because they've had the test many times, and they say it's no big deal, you know, and I have a grandparent who died of colon cancer, so my parents are, you know, big advocates of getting the test. But for them, they always say it's the prep part that's not so fun. The actual procedure is no big deal. You're kind of always evaluating, making the test a little bit more tolerable and preparing for the test, right?
Right, and our general approach is if you have normal bowel movements and a normal bowel pattern, you'll tend to get an easier prep. And if you have a slight tendency towards constipation, or if you have frank constipation, we just have a slightly more aggressive prep. And they're very well tolerated. And people, they get the most fearful about doing the colon washout the night before. And after the test, everyone's like, is that it? And that's a very common response, where it's over because they were often asleep during the whole test. And you get the occasional tough guy or tough gal who will want no sedation, and some people can do that, and they do it fine, but they request it.
Tiffany was like, huh? What?
No sedation.
But they request it. They come in requesting it, but anyway, but we typically do it with very adequate sedation, and people are like very pleasantly surprised. And they're surprised afterwards. They're like, is that all it was? I was afraid of this.
How often do you find polyps, particularly, let's say you start the test at 50. How many people are you finding polyps, or are you removing things that you think are potentially precancerous?
About 20 to 30% of the population has polyps, so we find polyps at a pretty high rate. Obviously, not every polyp turns into a cancer, but any polyp we remove, that reduces that patient's risk for developing cancer, because it'll never have a chance to go to it.
What do you think in terms of just our digestive health that people should be aware of if they're having issues with anything? Are there certain issues that someone might have that would lead them to come to GI Associates?
with respect to colon cancer screening, you know, the key message there is you have no symptoms when it's early.
Okay.
Most people have no symptoms, so that's why it's called screening. Screening is when you do a test looking for something to help prevent it. For other GI issues like heartburn and reflux and gallstones, you know, if they're in the bile duct, we can deal with those in conjunction with the surgeon. And so symptoms, you know, would be the thing that would prompt that. It's like
Any symptom related to the digestive tract, from the throat all the way down. And for, as you said, for colon screening, you don't need to have symptoms. Much like breast cancer screening, mammograms are done without any symptoms, without any findings on an examination. Colon cancer is equally important.
Well, and I think as women, I mean, and I can speak for myself, we're so good at having our annual OBGYN exam. You know, the screening tool for cervical cancer is excellent. Mammograms, most women are faithful about it after 40, getting those once a year. This is something that people should add to their routine too. And if you don't have any polyps, you only need to have it done, what, every 5 years or so, right?
Even
After
less.
50 or even less than that.
every 10 years if you have no family history.
Every 10 years. So it's a great thing to do. If you're clear, then you don't even need to have it done for another 10 years. So we're going to give people information so that they can visit one of your 14 locations. You can find out which one is most convenient for you by visiting this website. It's WIGIA.com. Again, that website, one more time for GI Associates, is WIGIA.com. Nice to have you both. Thank you,
Don't be
doctors.
shy. Go to the GI.
Absolutely, thank you.
She's got to make
I
a
use
run.
that?
It's all yours. It's all yours.
Thanks, you guys.